Hello and welcome to this new podcast of the American Journal of Public Health. We are with my good friend and co-host Vickie Mays in Minneapolis at the annual meeting of the American Public Health Association. And we look at the program and we find terrific topic, terrific session, and we try to select those that we don't see much in the journal or we don't talk much about in our podcast. And we are fortunate to have with us today Trina Adler from the University of Minnesota, who has been working on the good life. Good life. What does this inspire you, Vickie?
Well, I'm a Midwesterner, so I do know about things like the good life, particularly in Minnesota. But I'm going to turn to you and ask you, introduce yourself and tell us, how did this work come about? And, a little bit about the focus on the good life, particularly for American Indians and Alaska Natives.
Very good. Thank you so much for having me here today. The good life, that term comes from an Ojibwe word, Mino-Bimaadiziwin, and I'm sure that I didn't pronounce that very well. But it's a concept within the Ojibwe community that is about life in balance. And they talk about their relatives and being in balance with their relatives, but that's not just their family members that we might think of. It's also animals, it's plants, it's the sky, it's the water. It's all those in the community around them. That's who they are trying to remain in positive relationships with as part of the good life. The good life is also about being accountable to their ancestors as well as their great-grandchildren who may not exist yet. So it's this whole idea of living life in balance, and that will bring someone health and well-being. So you did ask me to introduce myself. I'm Trina Adler. I work with the University of Minnesota Extension, and I'm a program director. And what that means is I do a lot of great special projects. And this is one of the special projects I got involved with, is working with Native American women, primarily in the Twin Cities metro area, where we're doing some diabetes and other chronic disease prevention work. We're approaching it in a very unique and very deeply cultural way.
So excuse me if I'm a little bit ignorant about those issues, but would this be a Dakota concept or?
So the term that I used was actually an Ojibwe term, but within Minnesota we have many tribes, and in fact in the Twin Cities metro area, more than just individuals from more than just the Minnesota tribes live here. So the program that we're doing is representative of multiple tribes, and it's welcoming of multiple tribes, but taking a look at what are those essential cultural approaches, cultural traditions that maybe people have been disconnected from.
And so since we are here in public health, right, is the concept of good life applicable to communities or only to individuals?
Well, interestingly, and this is where we have recognized that the work we're doing really is not necessarily about diabetes prevention and chronic disease prevention, but it's really about taking a look at public health education and understanding the aspects of that really are quite colonized, and taking a look at how do we decolonize public health education. So it's this idea of connection with culture can lead you to health. And so taking a look at how are we facilitating folks really feeling they're connected with their culture and their traditions and their backgrounds. And then with that connection comes this feeling and this sense that they can bring that culture and tradition forward for their families and their children and their grandchildren in positive ways to help with the health of their whole community.
Let me just ask a question, because I grew up in Chicago. I live in LA now. And so in terms of having communities and tribes and groups, we have a lot of difference. So here, the voices, how do you ensure that their voices and their kind of original, we're the ones doing the colonizing. So how do you ensure that the Ojibwe, for example, are empowered to lead this? Because we all need good life. So how does this project help them to help us to understand good life?
Right. Well, for one thing, I am not one of the developers or the implementers of the program. We were able to secure some resources, and we recognized instantly that this was not for me to develop or implement. We were able to turn those resources over to the community so that they could work together to implement and develop the program. And I do want to express my gratitude. We have 2 Indigenous leaders on our staff, Elder June Blue and April Smith, who really have taken lead on bringing this out to the community. And then we've also had the opportunity to contract with some additional elders and teachers from different backgrounds and traditions who are bringing those traditions and cultural approaches into the group. So, my role has been really about the spreadsheets and making sure things get purchased on time and that kind of thing. And yet it's been a wonderful team experience from Extension to take a look at how are we doing public health work and how are we approaching public health education. And so this has had benefits far beyond the immediate women that have been involved in it, because I think as an organization we're learning a lot about how public health education can be thought about differently.
It's like being like a translator. So as you learn, you're helping to decolonize public health. And at the same time, they're empowering, to kind of have a larger group that they can share this with, which, is wonderful.
Yes.
If this concept or idea of good life works for certain communities, it must also potentially work for everybody,
Absolutely.
And so does the project go both ways, like allowing decolonizing education and allowing these ideas to go into new generation, but also how do the rest of the community, the rest of the country potentially benefit from this?
Oh, I think you're spot on with this observation that this is an approach that perhaps we need to think of far more broadly than this particular project, and really taking a look at how does our personal culture, our sense of identity, our sense of well-being, and our connection to others, how does that influence our health? And how do we envision community to be a part of our own health? And when we look at some of the evidence-based curriculum, and they're not, addressing head-on things like historical trauma and structural racism and, traditional ecological knowledge, and even ways that culture transferred knowledge, in the past. And if we're ignoring that through our public health education approaches for any community, then we're not doing them a service in terms of really being able to bring information to people in ways that resonate and meet them where they are and enable them to spread those throughout the community.
That's great.
I think it's very important that we just take this moment and thank the Ojibwe, particularly the elders, for sharing this, because good life is something, I'm traditionally trained as a clinical psychologist. Good life is something in terms of for all of us. Social connectedness, being able to root yourself in a belief system in which you're connected with the past and the present and the future, and you respect, how those all come together. So at least from our part as the American Journal of Public Health, we say thank you to them and you as the messenger around, kind of how this is taking place. So we're very appreciative.
Absolutely. We're deeply indebted to the elders and the folks who shared with us all along the way with this project for how freely they were willing to share with us and how important it is for us to learn the lessons that they were willing to bring to us.
I guess one of the final things I would say is that I will hope that the American Journal of Public Health can be a communicator when you all get, aspects of this project further along, that, we can actually help you spread this even further. So please consider us.
Thank you so much. We'd be most grateful, and I think that we're ready. So, yeah.
Trina, thank you very much for your time. I mean, it was a great conversation and a fascinating project. I think, you're touching at something very deep about what's the meaning of good life in Western societies and what's the meaning of good life in other communities that have a more holistic, because that's the term, concept of what it is, whereas we are, the Western vision is more focused on having good health and
Individual
things like
behavior
that,
change.
and
Yep.
the interaction with the environment and with the larger community is not so much part of our definition of health, so and of good life. So thank you very much, and thank you for your time again.
Thank you.
We were glad to have you here to be this, to give us this information. So thank you.
Thank you so much.
So thank you for listening. We were here with Trina Adler from University of Minnesota, and we talked about the good life, in particular in indigenous communities of Minnesota. Thank you for your time. And
Goodbye, everybody.
bye-bye from Minneapolis.